All right, why don't we get started? Again, good afternoon, good evening, everybody. I am Paul Melmeyer. I'm the Executive Vice President of Public Policy and Advocacy here at the Muscular Dystrophy Association, and we are thrilled to welcome you to our very first Advocacy Institute of the year. And tonight, we are going to be covering the advocacy year ahead. We'll be talking about those initiatives, those public policies, those efforts we're going to be getting a lot more involved in the year 2026. So before we get to our content, let's move to the next slide. And there is where I'm going to start with a handful of housekeeping items. Now, if you've joined us in the past, these are a review, but we might have some new folks joining us this evening. And so you are on WebEx. WebEx is maybe just a little bit different than some of the other video platforms you've used. So just a few notes here for you. So for one, on the left side, bottom left of your screen, right down there, is the little CC button. That's for closed captioning. Please feel free to click on that if you would like. And then we will be taking your questions, and the way in which we encourage you to submit your questions to us is to use the Q&A box. And to find Q&A, you got to go to the bottom right of your screen. That's where you'll see those three little dots down there. And if you click on those three little dots, you'll find the Q&A option that pops up at that point, and you can submit questions to our speakers from there. But also feel free to use the chat and chatting with each other and so forth, but it's easiest for us to be able to answer questions from the Q&A box if you don't mind. I'll mention that we are recording this session this evening, and we'll be posting to YouTube the recording in as soon as we can. So if there's something you miss, or you're joining a little late, or maybe you have to leave a little early for another commitment, that's okay. You can catch up on whatever you missed when the recording is posted on YouTube, as well as our MDA Advocacy website. So let's move on to the next slide, and I want to tell you what we're going to be talking about tonight. So already covered housekeeping. I'll introduce you to the team that's going to be presenting to you this evening. From there, we're going to talk a little bit about the year that was. We're going to look back at 2025, talk about some of our successes, some of our main focuses, some of the things that we really put a lot of emphasis on last year. From there, we'll reintroduce you to the areas in which we are active in public policy making, our three pillars, as we like to call them. We'll introduce you to those just in case you haven't heard us talk about them before, or maybe this is your first time joining us, and just a general primer on our work would be helpful. And then from there, we'll actually look at our activity in the upcoming year through the lens of our three public policy issue areas. We'll talk about what we're anticipating to be most active in, and where we're anticipating asking for your help the very most in the rest of the year. We'll also talk about some of the initiatives that we have planned for the year, including how to get involved in our grassroots advocacy program, how to get involved in some campaigns that we see coming down the road. And then, of course, we'll have some time at the end to take your questions on anything and everything that we have discussed. So with that, let me introduce you to the team that is gathered. We were so close to having the entire public policy and advocacy team present with us this evening. These are the six of us right here that work at MDA working on public policy and advocacy. You'll hear from five of us. Very unfortunately, Shannon Wood is unable to join us. She's a little under the weather this evening. So you'll hear several of us pinch hitting, covering our disability policy portfolio for her. But you have myself, you have Joel, you have Mark, you have Sean, you have Jory here, and we'll all be pitching in to talk about our year ahead. So with that, why don't we get started on our first topic, and that's where we're going to be talking about our the year that was, the 2025 year in review. So I know many of you were with us for much of the year, and you may remember the first half of the year was very focused on our efforts to protect Medicaid. This was in response to a congressional effort that was seeking to pass a variety of tax policies and other policies that cost a decent amount of money that Congress then was intending to reform primarily our Medicaid system to help pay for. And in the end, that's what they did. In July, they passed legislation that would pretty dramatically change the way that Medicaid works. And we have many advocacy institutes on that topic if you want to catch up on what ended up happening and what we're expecting from here. But at the same time, we were incredibly proud of the work that our community put in to prevent the worst potential reforms from happening. We actually avoided some of the most significant problematic reforms from being implemented, and that's because of all the folks who wrote into their lawmakers. We had over 13,000 letters sent from MDA advocates headed to Capitol Hill. And we know many advocates wrote op-eds and other letters to the editor in their local newspaper. We know folks visited their senators and representatives within their in-district offices and came here to Washington, D.C. to meet with them as well. So it wasn't for a lack of effort, for sure. It was actually a campaign all of us participated in to be very proud of. And as a result, it could have been a lot worse. But there are still some Medicaid changes that we'll be catching you up on even further in future advocacy institutes, I'm sure. But for tonight, as we're looking back at last year, we're very proud of the work that we put into that campaign. Another thing we're very proud of is the fact that we were successful in adding Duchenne muscular dystrophy to the federal recommended uniform screening panel for newborn screening. This is an effort that MDA has been working on, frankly, for over a decade at this point, and it all culminated in Duchenne muscular dystrophy being added to this federal recommended panel in December. And as a result, now starting in 2026 and beyond, states will be much more quickly adding Duchenne to their state newborn screening panels, meaning just little ways down the road, pretty much nearly anybody diagnosed with Duchenne will be diagnosed only a week or two after birth, thus officially ending the diagnostic odyssey for those who are living with Duchenne. So that's great news, and we're looking forward to continuing our work there. Our MDA on the Hill 2025, our Hill Day that happened at the beginning of November, was, in our estimates, our biggest ever, at least the biggest over the last 5 to 10 years or so. We are so proud of all the advocates who joined us in Washington, and we're looking forward to our future events in Washington and around the country, for that matter, bringing advocates to their lawmakers. And just to quickly go through additional accomplishments from last year, we have a new ICD-10 code for one of our limb-girdle muscular dystrophies, a diagnostic code that will streamline care for those with LGMD2I specifically. We continued the drumbeat on accessible air travel, including meeting with top officials at the Department of Transportation, encouraging them to do the right thing and make sure our community is protected and has safety and dignity when traveling by air. We built co-sponsors for a number of important bills, including the Alleviating Barriers for Caregivers Act, which we'll come back to in the context of our priorities for 2026 here momentarily. And we engaged advocates in new ways, including for one of the first times really diving into education policies and encouraging Congress by engaging our advocacy community to fully fund the Individuals with Disabilities Education Act. And frankly, we could even go further from here, but we know that the focus of tonight is on the year ahead. So we want to pivot and start talking about what we're doing in the future at this point. So let's move to the next slide. And when I say future, generally speaking, everything we're going to be doing is going to fall within one of these three areas. And that's a little bit oversimplified, but by and large, if you're going to look at an area in which MDA public policy is going to get involved and advocate for the neuromuscular disease community, it's going to fall within one of these three areas. So the first is in therapeutic development. This is where our team tries to ensure that more and better therapies are reaching our community more quickly than they otherwise would be. And this starts from the very beginning with that basic research that the National Institutes of Health funds at the laboratories across the country that are researching the underpinnings of neuromuscular diseases. And that goes all the way to the translational research, the preclinical research, into clinical trials that then tests some of these therapeutic interventions. We look at the regulations that FDA implements that oversees how these clinical trials actually are administered, all the way until hopefully FDA is approving that new drug for one of our neuromuscular disease patient populations. So our therapeutic development policy efforts are focused on everything that is part of that ecosystem. Our second area is in access to care. That's where we try to ensure if our community is seeking access to something that is there to assist or improve or maintain their health, that they have access to it, and that we break down any barrier that could prevent our community from accessing whatever that mode of healthcare could be. It could be access to durable medical equipment or genetic testing or quality health insurance or specialists or physical therapy, or you name it. If it can help our community as they maintain or improve their health, that is something that we are advocating for access for. And then our final area is in disability policy, also known as our empowerment and independence area. And this is really where we try to break down those societal barriers that still can stand in front of our community as they try their very best to live full and independent lives. And we're talking about barriers to accessing education for children with disabilities or for college students with disabilities, barriers to finding employment, or barriers in our benefit system that are incredible disincentives for our community to be able to pursue a career. Also, barriers to safe transportation or access to other benefit programs, or even the civil rights of those with disabilities. All of this falls within our disability policy focus area, and these are all things that we are tackling as part of our priorities here at MDA. So you'll see these three pillars, these three areas woven across all of the priorities that we have for 2026 and beyond. But of course, tonight we're focusing on 2026. You'll see how these three priority areas are where we're going to be focusing our attention, and consequently, how we focus exactly what we encourage you all to get involved with us on. So with that, we're going to move next to start to look into the year ahead. And by the year ahead, I really mean the next few days ahead. Because if there are those of you who have been following what's been happening in public policy, you know that there's a really big package, a legislative package, excuse me, that actually is in front of Congress right now. In fact, they're negotiating it pretty much as we speak. There's a lot of movement happening tonight with this legislative package. And just to kind of give you a reminder of what this is, it's appropriations bills that are initially intended to fund 6 different areas of the federal government, actually 6 of the 12 appropriations bills. But if you look at the amount of funding within those bills, it's 75% of what the federal government does. And this is a package that funds the Department of Health and Human Services, so many of the programs that are very important to our community, but also Department of Transportation, also the Department of Defense and the medical research programs the Department of Defense operates, which I'll say a few more words on momentarily. As well as this package also adds a number of different legislative priorities that we have had to it as well. And so their package passed the House a week or two ago at this point, and it's now in the Senate. But if you've been following the news, there's been reasons for why it hasn't been moving forward in the Senate. But I really can't emphasize the importance of some of the provisions. I can't emphasize it enough that are within this package of legislation. For example, we see very strong research funding at the National Institutes of Health being provided, as well as accompanying provisions that would limit bureaucratic interference within medical research dollars going from the NIH to the universities, to the labs that are at the cutting edge of research in neuromuscular diseases. We see stable funding for medical research at the Department of Defense's Congressionally Directed Medical Research Program. This is where there's $40 million worth of ALS funding and $12.5 million worth of Duchenne muscular dystrophy research funding, as well as eligibility for funding for a number of other neuromuscular conditions, including FSHD for the very first time. We see pretty good funding, adequate funding, stable funding for the Centers for Disease Control and Prevention, and specifically their ALS registry, their newborn screening programs, as well as their muscular dystrophy program. And then also HRSA, the Health Services and Resources Administration, is very important in the newborn screening ecosystem. They also get stable funding through this bill. That's the funding side of it. Over on the legislative side of it, this bill would reauthorize the Rare Pediatric Disease Priority Review Voucher Program, one of the most important, maybe the most important incentives for developing new treatments for neuromuscular pediatric diseases. And we also see the passage of the Accelerating Kids Access to Care Act, legislation that would streamline the process to be able to see specialists across state lines for children with rare or complex diseases who are getting their care through the Medicaid program. And there's more. We could talk about some of the disability programs. We could talk about the pharmacy benefit manager reforms that are included. As you can hear, this is a really big deal if it passes. And actually, as of the latest, as of about 45 minutes ago, it looked like the Senate might be able to have come to an agreement to pass this legislation tonight, sending it back to the House early next week. And we don't know that to be true yet. There's still things that they need to ensure tonight before they can actually move forward with that. What we will tell you is that When we get a chance to actually read what's in the final package, we don't have the bill text yet. We need to do that before we can give any formal recommendations. Once we've had a chance to actually look at it, we're hoping that you can hear from us tomorrow morning, in which we'll say, hey, the Senate did a good job last night, and now we're encouraging the House to finish the job and send the bill to the president's desk. But we still have some homework to do this evening or tomorrow morning before we can get there. But keep an eye on your email tomorrow morning, just in case. We hope to have some good news to share. So that's in the year. I mean, we're talking about the year ahead. Frankly, we're just talking about the next 4 days when it comes to the slide. But if this actually does come to pass in the Senate, in the House thereafter, signed by the president, this will be a very, very important piece of legislation for the neuromuscular disease community. So let's move on from there, and now we can start talking about the rest of 2026, because it's been about 15 minutes since we started, and we've only gone about 4 days ahead of time. So we have the next 11 months still to talk about. So let's start doing exactly that. And in a moment, I'm going to be welcoming in my colleagues to talk about the focuses that they have for the year ahead. But I'm going to start us off with our first bucket of focus, our first pillar, and that's in therapeutic development. And this is where I'm going to start by talking about the Act for ALS. Now, some of you might remember the Act for ALS or know about the Act for ALS. Its full name is the Accelerating Access to Critical Therapies for ALS Act. It was signed into law by President Biden. You can see him there, actually literally signing the bill into law in December of 2021. And it created a number of programs that are very important, not only for the ALS community, as you would imagine, given the name, but also a number of other neuromuscular and neurodegenerative disease communities, because actually the bill, most of the bill, is not specific to ALS. It actually is, in general, intended to benefit those with neurodegenerative diseases. Now, the first and largest part of this bill, this law at this point, is focused on ALS, and that's on expanded access. This is a process by which individuals with ALS can obtain investigational therapies, meaning FDA has not yet approved this therapy. They can obtain these therapies outside of clinical trials. And it's very important for those with ALS because the vast majority of folks with ALS don't qualify for any clinical trials. So it's oftentimes one of the only options that those with ALS may have in hopes they can improve or maintain their health. Now, what this program does is it provides funding through the National Institutes of Health to companies to actually offer their investigational product through expanded access. And that's a program that's been operational for several years now, and we're looking for it to be reauthorized. The second program I want to mention is the Department of Health and Human Services public-private partnership on neurodegenerative diseases. And this is, again, one of those areas that also includes ataxias, that also includes myotonic dystrophy, that also includes mitochondrial disease, and some other diseases, for that matter, that are neurodegenerative or neuromuscular in nature. And what this does is it kind of gathers all the stakeholders together, this public-private partnership. You can kind of hear it in the name. It gathers the stakeholder community together to try to solve the ongoing challenges in drug development for neurodegenerative diseases. And so for some, that might mean tackling biomarker or surrogate endpoint development. For others, it might mean creating that new endpoint for the clinical trial that better captures living with that specific neuromuscular disease. So there's different areas in which this public-private partnership is focused, but it is focused in ALS, but also outside ALS for that matter. The third area is a regulatory action plan that the FDA is implementing, where FDA outlines this is what we're going to be doing over the next 5 years to try to streamline the process of regulatory consideration and approval for neurodegenerative diseases, rare neurodegenerative diseases. And then the FDA also sets up a grant program to actually fund outside entities to do a lot of this work. They've funded work in myotonic dystrophy. They've funded work in ALS. They've funded work in some ataxias. So why I'm talking about this tonight is that this bill needs to be reauthorized. The authorization for all 4 of these programs expires at the end of September, so we're only about 8 months away from expiration. So what we need to do to reauthorize this bill is we're going to first be introducing the reauthorization here in the next month or two, and then we're going to be working with the committees in Congress. We're going to be working with our champions in Congress to make sure that a reauthorization of this legislation passes by September. And so that's what we're going to be doing from here on this, and we're going to be asking for your help as we go along this process. Probably this spring, probably late summer, early fall, as we're looking at August and September, right before the deadline. We're expecting Congress probably to work right up to the deadline again. We hope they don't, but their track record tells us they probably will. And so consequently, we will be asking for your help to try to get this bill reauthorized. But stay tuned for just a little bit later in the year, maybe just a month or two down the line, to hear more on this specifically. To move to the next slide, one of the next things we're really going to be focusing this year on is the user fee reauthorizations at FDA. Now, this is a very kind of wonky topic. Frankly, it probably deserves its own advocacy institute at some point. Maybe we'll do that sometime in the next year. But I'll tell you that the Food and Drug Administration, and it depends on the part of the Food and Drug Administration for how much of it is funded by industry-funded user fees, but invariably the FDA it gets funding from Congress, like most agencies do, and then they get funding from the regulated industry, such as biopharmaceutical companies, or medical device companies, or biosimilar companies, or the generic drug industry. They all pay a fee to FDA for FDA to then review products and subsequently potentially approve them. Now, as a result of FDA paying this fee and helping to fund FDA so that the review process is done in a timely manner, I'll tell you prior to the Prescription Drug User Fee Act being approved back in 1992, if I remember correctly, review times could be up to 2 to 3 years. So picture a clinical trial finishing and the data looking promising and then having to wait 3 years for FDA to actually approve that therapy. Thankfully, that doesn't happen anymore. FDA approves therapies anywhere generally from about 6 to 12 months after an application is submitted. And that's in large part because they have the resources to do so because of these user fee programs. But what these programs also do is they also reform the way in which FDA reviews therapies, the regulatory expectations, processes, timelines, programs that inform drug developers, that inform the FDA. Some of you might be familiar with the Patient-Focused Drug Development Initiative at the FDA. Maybe that's a term you've heard before. That's one of those programs that is created by one of these agreements. And so consequently, it's very important. It's very important in the world of drug development policy, these user fee reauthorizations. And this year is an important year because this is the year in which FDA and the regulated industry are negotiating on these agreements. And so in July, you can see in the top right image there, you might not be able to read the date below the title of the meeting, but it was July 14th in which the process kicked off last year. And for the Center for Devices and Radiological Health, CDRH, their medical device user fee efforts also kicked off this summer. And ever since then, industry and the FDA have been hard at work negotiating. And they've been negotiating on programs that are important for the neuromuscular disease community, including rare disease endpoint innovation programs, including coordination across the FDA on rare disease innovation, other programs that try to qualify surrogate endpoints and biomarkers and other drug development tools, so then other companies can use them to try to streamline drug development. All of the patient-focused drug development and patient-oriented involvement opportunities are part of this conversation. And so what our role is within this is to encourage FDA and encourage industry to be including these programs. FDA will be running them, industry will be helping to pay for them. Our role is to be telling both sides of the table there, hey, this is really important to our community. Make sure that this ends up in the agreement. So that's what we have been doing, and that's what we will continue to be doing through much of 2026, because this is a long process. It kicked off last summer. It's going to be going throughout this entire year. For the first half of the year, the negotiations are going to continue. We're expecting maybe sometime this summer the negotiations will wrap up and an agreement will be reached. And then the fall will be kind of crossing the T's, dotting the I's, making sure everybody up the chain of command is okay with it. And then next year in 2027 is when that agreement is handed off to Congress, and Congress is then expected to ratify it, essentially. So we'll be talking to you next year about how you can be telling Congress that they need to do their job. This year is all about encouraging FDA and regulated industry to be including the most innovative and the most patient-focused and patient-friendly policies as possible. And we'll be asking you to play a role in that process as well as in the process of getting this across the finish line next year in Congress. But this will be one of the things that we're going to be most focused on this year. Final thing I want to mention within therapeutic development before I hand over the mic is our efforts to continue appropriations, strong appropriations for the agencies that matter the most when it comes to medical research, the medical research ecosystem. Again, it might be in the next couple of days that fiscal year 26 appropriations will wrap up. We'll see. Maybe Congress gets the job done here in the next few days. And if or when that happens, fiscal year 27, that's starting in October of this year, will start immediately. The process to develop the next fiscal year's appropriations bills will start immediately. Now, first, what we can expect is the administration, the president, will release his budget, hopefully sometime in February. That's what we understand the target to be. And then at that point, the appropriators start crafting their bills, working on them throughout the spring, hoping to pass them out of committee in early summer, and then hopefully out of the full House and Senate before October 1st, when funding would otherwise run out. Now, what we're going to be doing throughout this process is encouraging the appropriators to ensure strong funding for the National Institutes of Health. Hopefully, we can get a nice, strong increase in their funding for medical research for neuromuscular diseases. We're also going to be ensuring that the Food and Drug Administration is funded well so that they can continue to ensure therapies are safe and effective that are reaching our community. The Department of Defense's CDMRP program, the Congressionally Directed Medical Research Program, hoping for strong appropriations in CDC as well. Also funding programs serving those with disabilities, the programs the Department of Education oversees, the civil rights offices across various different agencies, the Administration for Community Living, and a number of other programs that are directly intending to serve those with disabilities also receive funding through this process. So we do envision it will be a very important priority of ours up until October 1st and perhaps beyond. We'll see if they get the job done at that point for fiscal year 27. But nonetheless, appropriations really do make a big difference when it comes to the work that these programs do and the services that are offered to our community. So it will also be a priority in 2026 for our team and also for you. So with that, I think I have probably spoken long enough, uninterrupted. I'm going to invite my colleague Joel Kartner, I believe, who's up next, to start talking about some of our access to care priorities. So Joel, I hand it over to you.
Hi, everybody. Good to see you all tonight. So in legislative priorities in the access to care space, there is, as ever, a lot going on. First on top of the list is, again, the Accelerating Kids Access to Care Act. As you heard Paul outline so well, that is currently, to our understanding, in the package to hopefully finally make its way across the finish line. It's been quite the journey to get it there, so we're really excited to potentially streamline efforts for kids to receive the care that they need across state lines when they need to do that. Another major priority for us in the access portfolio this year is the ALS Better Care Act. Currently, under the Medicare statute, which is how many living with ALS receive their care, the only services that are reimbursed under Medicare are those that a neurologist provides or those that a registered nurse provide. And that leaves out a ton of what we call ancillary care. So things that are not directly related to ALS, but nonetheless play a role. So things like anything from stuff as major as cardiology to physical therapy, occupational therapy, respiratory therapy, durable medical equipment consultations can fall under ancillary care. There's just a ton of services that folks living with ALS need that are nonetheless not reimbursed by Medicare. And as a consequence, the folks that provide that care pick up the tab for those services at cost, which consequently puts a ton of strain on the hospital systems that do that. And so typically what will happen is they offer less services or decline to open a clinic where they are at all in lieu of providing those services. What the bill would do is it would allow for the billing of Medicare for those ancillary services. In doing so, obviously that's better for those living with ALS because it means that hopefully hospitals will start providing more services and will be able to do more robust things in the clinics because they are now being properly reimbursed for the services they provide. But also we're hoping that that will benefit patients in that maybe more facilities will start offering ALS-centered care in their facilities because they can now pay for it. So for example, in Maine, there isn't an ALS clinic. Leaving someone living with ALS, their closest center would then be in Boston. So they have to travel all the way to Boston whenever they need to receive care. Hopefully, by having those services better reimbursed, we can get a center in Maine. Or maybe hopefully centers would start doing things like launching more clinical trials, which is obviously very costly in any disease state, but particularly in ALS, which that might then open up more avenues for research, which then hopefully benefits those living with ALS down the line as well. So lots and lots of potential knock-on effects to a bill like this. So it'll be a big priority for us to hopefully get that over the finish line this year as well. While there is pharmacy benefit manager reform in the package that we were just talking about tonight, believe it or not, there is still more to do in that space. The package largely deals with transparency on the part of pharmacy benefit managers, which, just to pause for a moment, for those of you who might be unaware of pharmacy benefit managers, although I promise you've probably heard the ads for them lately, pharmacy benefit managers are the middleman in your quest to get the drugs that you need. They help pharmacies and drug companies set the formularies for what's covered under various insurance plans, and they set various rebate rates for drug companies and pharmacies. And as kind of a fee for that service, they take money off the top, essentially. That's a very, very simplified explainer on the PBM. And so transparency is then has been a big effort of Congress over the last couple of years, and hopefully in this package we will see some transparency measures taken up by Congress. However, there are new tactics PBMs have been engaged in over the last couple of years, so we hope to see some action in regulating PBMs, things like in specialty pharmacy, or oftentimes a pharmacy will also own their own PBM, and so that creates some other issues. And so we are looking to see Congress take up the mantle on regulating some of those actions as well. There are some wheelchair repair bills, which we're always hearing is a big, big concern from across the neuromuscular disease community in terms of timely access to having their wheelchairs repaired, whether that's by themselves through something like a right to repair, or from a wheelchair company or a wheelchair repair company. So we're looking at a couple of different actions through legislation, which might make it easier for those repairs to take place, or cheaper for those repairs to take place. And there are a couple of bills out that we would like to see make their way through Congress this year. There's the Access to Genetic Counselor Services Act, kind of similar to the ALS Better Care Act. Genetic counselors are not fully able to be recognized under Medicare, which consequently makes it much more difficult for them to offer their services. So the hope is, by getting them covered under Medicare, the knock-on effect would be that their services are easier to access, allowing folks to receive a diagnosis, as we know many of you are still waiting for, or maybe you have siblings or cousins or things that need to kind of make their way through the genetics process to see what their profiles are. And then we're hoping that we can widen access to genetic counselors through a bill such as that one. There will be other affordability efforts. I'm sure all of you have heard that particular buzzword, if nothing else, in the political ads for various folks running for office that you've doubtless seen as you make your way through the world. So we're sure that there will be affordability efforts, and we're looking forward to parsing out which of those will be most effective for the community. So we'll be keeping an eye on those. We'll continue to work on Medicare Part D implementation. There'll be more on that on the next slide. And then ACA 504 and HCBS work and protective work, which again will be in the coming slides as well. So Jory, with that covered, we can head over to the next slide. And Here you'll see some of that Medicare and defensive work here. So there are some key updates to Medicare making their way through the regulatory process these days. And before we get there, I just want to give a very, very quick primer on Medicare for folks, just in case it's not a thing that you're familiar with. Medicare is split up into 4 parts: Parts A, B, C, and D. Medicare Part A is your inpatient services, so things like surgeries and hospital stays and stuff like that in the inpatient setting are all covered under Medicare Part A. Medicare Part B are your outpatient services, so obviously outpatient services, but things like physical therapy, infusion services are covered under Part B, things like that. Are Part B. Medicare Part C is Medicare Advantage, so that's kind of your all-in-one bundled service that you'll typically purchase from a private company who is contracted with Medicare to provide that kind of bundled service. It often includes the option to buy things like vision and dental care as well. So that's Medicare Part C. And then Medicare Part D is access to drugs and therapies. So things like specialty pharmaceuticals, things like that are covered under Medicare Part D. And it is in Medicare Part D that we see a lot of action taking place currently. So currently, the administration is trotting out what they're calling the GUARD program, which is a demonstration period under Medicare, which is trying to kind of pull back the curtain on what is causing so much expense in the Medicare Part D program. And as a consequence, they're looking to throw out a testing period, basically from 2027 to 2031, which, believe it or not, is closer than you would think it is. Looking at payment plans, the mandatory part of that participation is pharmaceutical manufacturers looking at selected drugs that apply to approximately 25% of Medicare Part D beneficiaries that are based on where they reside. So looking at the highest spend by way of zip codes. Included drugs, the target model looks at brand drugs and biologics within 17 specified therapeutic categories, including antineoplastics, antivirals, and immunological agents. Exclusions, because I know those are really complicated buckets, are things like biosimilars, and various generics are not included in this model. And basically the plan is to look at what are the highest cost drugs in the highest areas, zip code wise, to see if they can't bring those costs down. There's also another model that would look at most favored nation methods for bringing down cost. And that's basically looking at what do other countries pay, which can in some instances be less expensive than what we pay here in the US, and trying to implement those cost controls by bringing them over to the US. What I will say there is there are a couple of points of concern, one of which is there is no point of sale benefit, which is CMS has explicitly stated that GUARD rebates will not be visible to beneficiaries at the point of sale. So basically, when you go to pay for your therapy, that is the price that you will be paying, essentially. And that rebate is retrospective to payment for the manufacturer, not necessarily for the patient. So you, as someone who is purchasing a drug, would receive, in theory, a lower price point, but you wouldn't necessarily see that savings. You would see that savings on sticker. So the price when you're choosing which therapy, but not necessarily at the point of sale, which I know is fairly wonky. You could, in theory, see increased cost as manufacturers kind of move around and kind of see what they're being asked to pay for under the most favored nation model particularly. And then there may be some market volatility based on what therapies are affected and what therapies aren't. Moving past the GUARD model, you may have seen Trump RX is a model that's been trotted out. And basically what that is, it is a federal government website that doesn't sell drugs, but does attempt to direct folks to the best prices. If you've ever used GoodRx, they're kind of similar-ish models. Why it matters for Part D beneficiaries is that in theory, it's steering folks to cheaper options and allows people to track what therapies cost what, essentially, across the model. Some concerns that we have about that, though, is that any drug that is purchased through TrumpRx does not count toward the Part D deductible. So that $2,000 out-of-pocket cap that we worked so hard on a couple of years ago, that those of you might have been around for, it doesn't count toward that cap, which is honestly our primary concern. There are a couple of other changes coming to Medicare Part D that we've been working really hard on. And essentially what we've advocated for in that space is that the administration keep Medicare Part D as transparent and open as possible as they continue to make changes. There's also this thing called the Notice of Benefit and Payment Parameters in the Affordable Care Act market space, and that is the process by which the Department of Health and Human Services lays out insurer rules, program integrity, consumer protections, and payments for plan years in the ACA. That is currently stuck at the Office of I'm blanking on the actual acronym for OPM means. But basically, that is currently stuck in an administrative process before we can see what that rule is. But once that rule comes out in full, we will make sure to advocate for as robust a rule as possible. And just to correct myself real fast, that is the Office of Personnel Management is where the Notice of Benefit and Payment Parameters is currently stuck. And then we're also working on the 504 rule. So the 504 rule is the grandfather of disability rights law. It is under the Rehabilitation Act, it's Section 504. And essentially it says that if you are a federally funded entity, then you must provide access to the services that you provide for folks with disabilities under this law. Currently, there are potential rollbacks, anything as broad as rolling back the 2024 rule, which basically did a lot to update what's required under Section 504 because that rule had not been updated in a period of about 25 years. So there was a lot to kind of catch that section up on as life and modern times have continued to roll forward. If they don't roll it back entirely, then there were various protections for those that are in the trans community or otherwise need to receive gender-affirming care, which may be rolled back. And there's also a lawsuit currently seeking, again, to roll back the 2024 rule that we're keeping our eye on, and we'll be working as robustly as possible to act defensively for the 2024 rule, as there is a ton in that rule that you can find on our website that we are incredibly proud of. So we will be working to defend it as best as possible. Next slide. And then outside of kind of the regulatory landscape, there's a ton in the access and disability pipeline. You'll see or hear from us occasionally that there are areas that kind of split between any one of our given areas and home and community-based services. And in some circumstances, civil rights is one of those fault lines where you'll kind of see Shannon and I working together. So we'll be working on strengthening HCBS, home and community-based services, and community living through things like the HCBS Access Act, which is a really impressive bill that does a lot for HCBS. The biggest thing that it does is it takes HCBS, which is currently a voluntary benefit out on the part of states, and makes it a mandatory benefit. So taking it out of the hands of the budgetary processes for states and just says, hi states, this is a thing you have to provide along uniform lines, essentially. Because you'll often hear me make the joke that if you know one state's Medicaid policy, you know one state's Medicaid policy. So making it so that community services under HCBS are uniform is incredibly important. Similar to that, there's the HCBS Relief Act. Under COVID, there was some squirreliness with how HCBS was being funded, and essentially the HCBS Relief Act helps kind of top up that funding and make sure that funding for home and community services and community living is as robust as possible. All of this is particularly important given those changes to Medicaid that Paul mentioned at the top are coming. HCBS, again, being a voluntary waiver, states may choose to cut various things kind of in that vein to deal with the shortfall of not receiving as much funding from the federal government. So we're incredibly engaged in trying to make sure that HCBS is as well funded in other areas, particularly federally, as possible. There are also various protections that we want to make sure that we're taking part in. As I mentioned, there's a 504 lawsuit that we're dealing with right now. There have been various legislative efforts over the years to create a notice period for Title III of the ADA, essentially basically saying that if businesses are found to be not in compliance with the Americans with Disabilities Act, which ensures that private entities need to meet various basic accessibility standards. If they're found to be out of compliance with the Americans with Disabilities Act, they're required to give notice or receive notice that they're out of compliance so that they can attempt to address that, essentially. We're quite opposed to this because, frankly, the ADA has been around for decades now, and we think that's quite enough notice for businesses going forward. And so we don't think that additional notice is necessary. There are also Air Carrier Access Amendment Act updates that are moving forward. The Air Carrier Access Amendments Act attempts to make it so that air travel is as robust as possible for those in the neuromuscular disease community, particularly those that use wheelchairs to fly when they need to. It's celebrating a very important birthday. It's been 40 years since its passage, and we know there is much work that remains to be done to make air travel truly accessible for those in the neuromuscular community, and that injuries do still occur, devices are still damaged, etc. We know this area is one that we're working on very robustly in 2026 to try and make sure that air travel is as both safe and accessible as possible. And there are various rulemaking processes and lawsuits that are going to be going on there as well. And that should be challenges to the ACA, not ADA. But as long as the ACA has been a thing, there have been challenges to the ACA. We expect that those will continue going into 2026, and we will be working to make sure that the ACA is as robust for a community as possible. And with that, I will hand it over to Paul to talk about family caregiving.
Yeah, thank you, Joel. And we're going to move quickly at this point. We realize we're 12 minutes from the hour. We still have a good amount of content. As you can tell, we're in our third area, our disability policy portfolio, and we're really going to be prioritizing our work to support family caregivers this year. That includes campaigns and efforts to pass the Alleviating Barriers for Caregivers Act, which is going to be one of the biggest bills we'll be supporting. It streamlines government services and support for family caregivers, as well as the Credit for Caring Act, which provides tax credits for the costs of caring for family members. To move to the next slide, within this area, we're also going to be working to improve both transportation and access to benefits for those with disabilities. The transportation area, we're expecting further air travel rulemaking from the Department of Transportation, and so we'll be looking to do our very best to influence that rulemaking in the best direction as possible for all of those great air travel accessibility reforms to be implemented. And Congress is due to reauthorize surface transportation authorities this year, and there's ways in which we can make surface transportation more accessible through those efforts as well. Within our efforts to improve disability benefits and services, we're going to keep pushing on the SSI Savings Penalty Elimination Act, which reforms the way that supplemental security income works so that it's not such a disincentive to work and build wealth. And they'll also advocate for legislation on claims processing at the Social Security Administration, as well as just keeping an eye through appropriations and otherwise to ensure that these programs remain strong at their agencies across the federal government. With that, I'm going to hand it over to Jory Hauk, who's going to introduce you a little bit on our education policy portfolio.
Good evening, everybody. So just to give you a little bit of where our focus will be coming up here with education policy, really falls into two buckets for this point. So we do want to cover within strengthening access to education, our IDEA full funding act support and our related appropriations work. So as a refresher, the Individuals with Disabilities Education Act, or IDEA, guarantees students with a disability, including members of the neuromuscular community, the right to a free and appropriate public education, also used by the acronym FAPE, in the least restrictive environment in the general education classroom, least restrictive environment often referred to as the LRE. So as you may imagine, IDEA resources are vital for members of our community in obtaining those individualized education programs, also known as IEPs, classroom accommodations, and more that make that FAPE possible. So currently, the federal government contributes less than 15% of the costs related to educating students with disabilities, which is well below the original 40% promise when the law was passed and signed in 1975. The good news is, though, that the IDEA Full Funding Act will hold Congress to that original goal of 1975, which was 40%. And so we are working very closely, not only as an organization, but with our coalition partners especially within the Consortium for Constituents with Disabilities, who really have that education expertise to ensure that IDEA is not only robustly appropriated, robustly funded, and adequately enforced for the programs within the law, but also that we're really looking for the IDEA Full Funding Act as the true gold standard for the law. So shifting gears a little bit to the RISE Act, this is a bipartisan bill that would ease the accommodation process for college students with disabilities. We're anticipating that a markup could come as early as February, so we'll be pivoting our attention to that if and when it does happen. And then third is a call for stories from the community. So if you've had experience navigating the accommodations process as not only a college student, but maybe with a loved one or a friend or another family member, we want to hear from you. So we'll share our contact information at the very end of the presentation, but we do want to just put that call out there as well to give us a shout if you have something you'd like to share related to the college accommodation process. So I'm going to adjust just a little bit and talk a little bit for a moment about how you can get involved with us in 2026, kind of a nice crescendo to what we've been talking about all evening. So what is your role as an MDA advocate? Well, quite frankly, there's a lot here on the screen, and that's because there's a lot that we are, that we ask you to do. So just as some background, policymakers often rely on your stories and your direct experiences as they're making their decisions on how to vote, how they're crafting their legislative strategy, all sorts of things. And as you well know, no one can tell your story better than you. I certainly can't, I certainly don't want to speak for others, and that's where but that's where we want to meet you, is where you have the experience, we have the tools to make sure that you have what you need to share your stories and get those stories in front of federal policymakers. So how do we do this? We do this in a couple of different ways. This is not an exhaustive list, but just to give you a little bit of a preview. We offer our online offerings in a couple of different ways. We try to send very timely but also in-depth emails about not only neuromuscular disease related policy, but health policy in general and related disability policy news right as we get it here from Washington, D.C. We also host our live virtual events, just like the Advocacy Institute and office hours that you're on. You're on the Advocacy Institute now, but office hours are another option as well. You can also take action and send messages to your federal officials on a variety of those legislative and regulatory topics. And then finally, what are some opportunities that you can do offline, but also in person? Write to your members of Congress, visiting your members of Congress, their offices in person, engaging with the media and writing blogs, social media, etc. And then last but not least, organizing in your community. This could be anything from talking with friends and family about your advocacy work, challenges that you've experienced, and just generally finding that community support. So I do want to turn it over to Mark to talk a little bit more about getting involved with our grassroots advocacy program.
Thanks, Joy. I appreciate it. I see lots of familiar faces, but I also see some new folks too. So welcome everyone, especially our new and returning folks. So Joy mentioned a lot of amazing ways to get involved, and we have lots of options. But we try to boil it down to 4 easy things that you can do right now, especially if you're new. The first is please sign up to join us at MDA Advocacy. You can do it at mda.org/advocacy. Maybe someone forwarded you this webinar or you found it on a social media post, but if you're not on our email list, please go to mda.org/advocacy. That way you can get all the timely updates to make sure you're informed, and so we can share with you how to message your member of Congress. On that site, you'll be able to see your action center that has all of our actions and all the ways you can contact Congress on very timely issues. We provide you with a sample letter that we encourage you to edit and make it personal, but we give you a head start. When you enter your contact information, we will automatically connect you to your member of Congress. So if you're not sure who that is, that's okay. We'll ensure that you send your letters to the right members of Congress. Our Action Center, we also have all of our policy communications. We have ways to share your story. We have webinars, all sorts of things there. So we really encourage you to explore the Action Center. The third thing is, well, you already did one of these, you can attend our Advocacy Institutes. But if you also want to, Jory mentioned this, you can attend our monthly office hours. They happen during the once a month during the afternoon, where we open the line to you and you get to ask us anything you want about our advocacy program, what's going on in DC. It's really an open time for you. So folks who are on this call, you'll get those invites as well. And the third thing is we really encourage folks to share their stories. It's the most powerful tool in your advocate toolbox is your story. And there's 2 that we're really focusing on right now. The first is our caregiving campaign that we're launching. We are collecting stories about caregiving from across the country and about folks' interactions with caregivers, how some of the hurdles they might face, some of the things that your caregivers might do to assist. But we're also particularly looking for stories and experiences from people who are family caregivers. So if you're a family caregiver, or you have a caregiver in your family, we encourage you to share your story and your experiences with us. And I'm going to put a link in the Q&A box right now. So if you're interested in doing that, please share your caregiving story with us. In addition, we're always looking for stories around air travel. I see some of this going on in the chat right now. But if you had an experience with air travel, please share that with us as well. There will be lots of opportunities for us to be sharing these stories with lawmakers and folks at the Department of Transportation. So these stories are super relevant and they're really, really helpful. So those are 2 of our story asks. So those are 4 things that we think you can do right now if you're especially new to us and you want to be able to make your voice heard. And with that, we'll turn to Sean Hill, who will talk about one major opportunity we'll have later this year. So Sean, we'll turn it to you.
Thanks, Mark. What you've heard a lot of this evening is how you can get engaged. And part of that is typically centered around legislative or regulatory activity. However, there's another way that you can get engaged, and through voting. And typically, MDA has focused on accessible voting. Many of you may be aware that this year it's time for another election, what we typically refer to as the midterms. There are openings in Congress, statewide, and at the local level. All House of Representative members have to run for re-election, so that's 435 seats. There are 33 seats in the Senate, and there are 39 gubernatorial elections taking place this year. Election day is November 3rd of this year. And I'm going to take a quick look back. Many of you may recall, if you were here with us in 2024, we launched a campaign called Access the Vote, designed to provide you with information about your rights as a person living with a disability in terms of your voting. We provided you with all kinds of resources in terms of the history of disability in voting, how to evaluate the candidates, so forth. Well, here we stand again. So we hope to revitalize access to vote. So you will start to see in the coming months activity around that, an opportunity for you to get engaged. We really do want to provide you with tools that you can use as you move forward and start to make decisions about what you may do come November. Again, we'll highlight some of your rights as a voter living with a disability. We'll walk you through some logistical resources and again, some tools of the trade, maybe about how you are conducting your evaluation. But one thing we certainly want to make sure we mention is that MDA is a 501c3 organization. We are not allowed to engage or support any particular candidate or party. Our efforts are simply to educate and perhaps provide you tools. We realize that voting is a very personal and private thing. It is not our intent to engage in any way possible how you vote. We simply just encourage you to vote. And with that being said, I'm going to turn the floor back over to Paul for Q&A.
Thank you very much, Sean. And you can see some final resources that we have here on this last slide, ways to send any questions to us that maybe we didn't have a chance to get to tonight, or maybe it comes to you later. You can email our advocacy inbox at advocacy@mdausa.org. Our action center is at mda.org/advocacy. And if you have a question for us that's for MDA that might not be policy related or specific, might just have to do with anything else pertaining to living with a neuromuscular disease, our resource center is here for you. And that email address, resourcecenter@mdausa.org, is right there, as well as the phone number 1-833-ask-MDA1. So we are at 8:02. We are already over time. We just had so much content to give you tonight. We just couldn't contain it within 1 hour. We do apologize for that. And we did get to answer a lot of the questions in the Q&A box with written responses having to do with the ACA tax credits that are still being negotiated in Congress, potential Department of Education moves that we're evaluating the appropriations deal to see if or what happened to be within the appropriations deal on special education potentially moving to the Department of Health and Human Services, and more. And I know there's lots of chatter happening in the chat itself. Hopefully, if you asked us the question there, it got answered, or you put it in the Q&A box. But knowing that we are a few minutes over time, and for those of us on the East Coast, it's already after 8 o'clock, it's getting close to some of our bedtime. So I think we might close it there. And again, if you do have questions that we didn't get a chance to answer today, please do email us. Advocacy@mdausa.org is the way to reach us. We are always monitoring that inbox and will always respond. So please reach out with anything that you have. But I'll close by saying it's going to be a great year. It's going to be a great year ahead. The advocacy team is looking forward to working with all of you in accomplishing all the goals that we outlined for you this evening. We can't wait for all the amazing work we're going to do together. So with that, have a good rest of your evening. Thanks all.